is to participate with us as we go ahead and begin a process for mass immunization. For this purpose, we are addressing the needs of the refugees that are being resettled in our community. Every year we see about 2,000 refugees that come to Kentucky and will actually stay in Louisville as part of a resettlement process. Refugees are different from immigrants in that refugees are here because there is some sort of persecution in their home country. So these people apply to be resettled in the United States and literally leave everything when they leave. They leave their families oftentimes, they leave all of their possessions, they leave their culture, they leave any economic and social support to restart their life in Louisville. So when we think about the needs of this group, we have to appreciate the fact that they are so incredibly brave, and it's our opportunity to demonstrate then how much we value them as individuals. Now, part of this process means that we provide all age-appropriate vaccines for adults, adolescents, and sometimes the children. So it means that we need to be particularly adept at evaluating how they respond to vaccines, anything that we know about them from their history, and then recognize that they're going to have differences in terms of their individual cultures and values. So we need to be very intuitive with our approaches to them and very comforting. And also recognize that, again, they have left everything to restart their lives in this country. We're providing vaccines not only for their safety, but also for the safety of our own community. So as you're here today, I'm going to go through what our process is as part of this mass immunization vaccine program. Every person, as they are enrolled in our process, will have an individualized immunization plan developed for them. It'll be based upon any information that we have from their overseas medical exam and any other records that they may have that show vaccines that they have received in the past. If the vaccines are within the particular recommendations that we have as part of our national vaccine policy, then we accept those vaccines. Sometimes, however, vaccines may be given and the interval may be inappropriate for our particular vaccine strategy. If so, we may have vaccines that are repeated. But each person will have their own plan. This will follow them throughout the process over the course of the next 6 or so months, and then will be given to them upon completion of their immunization series. This will be important for the refugee because they use these vaccine records as part of their step towards citizenship as they apply for their green card. So it's very important that we keep a hold of this and that we do all of the documentation completely and legibly. In order to assist with this, and also recognizing that this is an error-prone process, we will have many individuals that do not speak any language. Oftentimes names are extremely similar among families and then among communities. So we have to always double check that the individual receiving the vaccine is in fact the person that is holding this vaccine record. So using that opportunity to always double check will be important. In addition, we have predetermined where each vaccine will be given, again as a way of error proofing. So for example, we have determined that all tetanus involving vaccines will go in the right arm. They always go in the right deltoid. So if an individual goes to administer a vaccine and there is already a Band-Aid in that spot, then that is a signal that they need to stop and double check just to make sure that there is not an error. Of course, as we are providing several vaccines, there may be the need to give more than one vaccine in the same muscle. So it may be perfectly appropriate that that Band-Aid already be there, indicating that a vaccine has already been given. But it's a cue to us to stop and double check. Also, as an error-proofing process, we have predetermined and pre-made stickers that will have the name of the vaccine, the trade name, the location where it is to be administered, and the lot number. Those stickers are used and are provided at each table so that they can be adhered to the vaccine record once the vaccine has been administered. The individual giving that vaccine then will date and sign that as our way, again, of providing complete documentation for that individual vaccine. Now, the vaccines come in various ways. Some are in pre-filled syringes, some are in single-dose vials. Some on occasion, perhaps flu, may come as a multi-dose vaccine, but we want to really limit that because there is more opportunity for error. It's important to remember that anything that is in a pre-filled syringe or a single-dose vial is likely to not have a preservative. So that means as soon as the seal is broken, we need to be prepared to administer that as quickly as possible. We also need to make sure that we understand that a preservative is there to prevent microbial growth. So once the seal is broken, then that means that the clock starts, in essence, for the opportunity for that item to become contaminated. So we need to handle it very judiciously and ensure that contamination does not occur. So I want to demonstrate just a couple of ways that we will prepare and handle vaccine. All vaccine is transported in a cooler that is designed to handle vaccine so we can maintain that temperature. The coolers have all been tested multiple times to ensure that they maintain an acceptable temperature despite being opened and closed multiple times. At each table, we'll have a container that will have an ice pack and a very limited amount of vaccine. That again is just a step for error proofing. Vaccine is not to be left out for extended periods of time, and usually our vaccine clinics only last a couple of hours. So we try to put only the amount of vaccine that we anticipate to use and then quickly return it to its original storage area as quickly as possible. Vaccines may come several ways. Again, it may come in a pre-filled syringe. So if it is in a pre-filled syringe, the cap that protects the tip is to be removed immediately before the needle is applied. So as you're gathering your equipment, make sure that you have everything that you need at your fingertips so you don't have any exposed areas or that you're fumbling around and perhaps then provide an opportunity for contamination. So for this particular syringe, if it is an adult, we're going to use a needle that is 1 inch in length. If we have someone that has a little bit more tissue, somebody that maybe is over 180 pounds or so, we may consider using a little bit longer needle. We may use 1.5 inches. The idea is to make sure that IM injections are given directly into the belly, or the biggest part of the muscle. So selecting the appropriate needle length is important. So adults, we have 1 inch long needle. For children, we'll use a smaller needle. We'll have a needle that is 5/8 of an inch in length. So always make sure before you prepare a syringe that you've double checked your equipment to make sure you've got the right items. So for this particular vaccine, this is part of our vaccine for children, or VFC stock. So we know that this is only going to be used for children. So anytime you handle vaccine, you always make sure that you perform hand hygiene before you do anything, before you touch it at all. You can use an alcohol-based hand rub or soap and water. You will remove this cap by twisting the end off. So you twist it off, but make sure that you are nowhere near that point that will be exposed. That will go directly and immediately screwed into that clean point of your needle. Make sure then that you double check and go ahead and give it a very firm twist so you can make sure that it's together. The cap should remain on until you are ready to use it. Go ahead and then remove any air, your air bubble, right before you use that, so it's prepared and the needle is covered at all times. Once you're finished, you will throw your needle and your syringe and any vials or anything that's glass, go ahead and put in the sharps container. As you are preparing vaccine, it's also important to spend a moment and make sure that you know your equipment. So for example, these needles all have safety devices because the protection of our healthcare worker is important. So make sure that you take the opportunity to practice with one, or make sure that you know exactly how it works. So for example, this particular needle has a cover that you'll use your thumb and you can push over and then snap in place once the needle has been used. Immediately after use, you should activate your safety device and then throw it in the sharps container. And I'll show you more about this as we go through the actual vaccine administration process. Sometimes you'll have a needle and syringe that will be packaged together. If so, you want to maintain the sterility of the two ends that will be touching each other. So in this case, we have the open end of the orange needle, and then we will have the tip of the syringe. Pull that out and then quickly and firmly twist it into place, and then it will be ready to use in the event you're going to draw up vaccine. So always take time to practice with your equipment so you know what to do before you actually administer any vaccine. We will have some vaccines that require that they be mixed with a diluent. The diluent is always provided by the company, so you will not just pick any diluent, you will use only that which has been provided for that particular vaccine. So for our MMR and varicella vaccine, Merck, the company, has provided us with the diluent. Each diluent is in its own vial, it's a single dose. You will remove the plastic cap and then always disinfect. Anytime you have a plastic cap always disinfect the top of that vial. This doesn't mean that it's sterile, it just means that it was protected from inadvertent damage. Take your alcohol swab, and then you want to spend about 10 to 15 seconds disinfecting the top of that vial before you use it. Now this is any diluent or any time you draw any medication, but just very rigorously, you know, and with some pressure, disinfect the cap, and then we want to let it dry for a few seconds. It will dry very quickly. When you're done with your alcohol swab, then go ahead and throw it away. For this particular diluent, we'll go ahead and take our 1 cc syringe, and then we'll take a 5/8 of an inch needle, because the MMR and varicella vaccines will both be administered subcutaneously. We'll screw those firmly together. Our vaccine top has been disinfected. You can inject air into it if you want, or you don't have to. But what I do, I will tilt the vial and then also tilt the needle, so the tip of my needle is right down in the corner. And then I can draw the diluent out without struggling so much with it or having a syringe full of air. Once you draw all the diluent out, and you want to try to get as much as you can, and there's about 0.7 in this syringe, or in this vial. Go ahead and you can get all your air out. Always make sure that air is out and you're ready to go before you pull your needle out of a vial. Then you can recap the needle. Now you'll say, oh my gosh, I was taught not to ever recap a needle. Well, certainly you never recap a used needle. When you have a clean needle, your goal is to protect that needle because you will be using that again. For this diluent, I'm going to be injecting it into the vial of vaccine. So I need to make sure that this end it remains sterile at all times. Okay, I'm going to take this and I'm going to show you, I'm going to walk to an area where I have a student that's going to allow me to demonstrate then how we would to administer a vaccine. I'm going to go through how we would administer an intramuscular as well as a subcutaneous vaccine. So if I can have my wonderful volunteer to sit down by me, that would be great. All right, anytime you are administering a vaccine or any medication, always make sure that you have everything in place and that you are ready and that you can move very quickly. We will always explain this procedure to our vaccine recipient. In the case of the refugee immunization, we have already had interpreters that have gone through a description of what to expect, so they will know what is going to happen to them when they come for their vaccines. So I just want to focus on the particular technique. Anytime you give a vaccine or any medication, if it's going to be injectable, you want the medication that you are administering. I always have a 2x2, an alcohol swab, and a Band-Aid with me because I want to have everything close by so I don't have to fumble. For the actual administration, I'll take my 2x2 and alcohol swab. Thank you. And then just relax that arm. But I want to vigorously rub the spot. And then once I'm done, I visualize the spot where I'm going to be administering the vaccine. Put my finger on the notch and drop down 3 fingers below the notch, and that's the targeted area for my intramuscular vaccine. So I want to keep my 2x2 and my alcohol swab kind of underneath my finger, so it's going to be ready and available for me once I've administered the vaccine. When it's time for me to administer, and again, when I'm going to give an IM injection, I'm going to have a longer needle, so I'm just using this syringe as a demonstration. But I'm going to go ahead and quickly dart that area. I drop my fingers, my index finger and thumb, and that kind of secures the syringe. That way I can go ahead and aspirate and make sure that I don't draw back any blood, and then go ahead and inject the vaccine. When I pull the needle out, that enables me to then quickly slide that 2x2 and alcohol swab down over the site so I can cover that site, and then I can watch what I'm doing with my needle. I can activate the device. I don't have to worry about the patient bleeding or anything going on because I'm touching the patient, holding pressure at that site. And now at the same time, I can activate my safety device. Once that's activated, then I will immediately discard that, and then I'll use my Band-Aid to cover the site. Now for a subcutaneous injection, we do pretty much the same thing. We will give it in the area, kind of what I call the back wing, or this little skin flabby part in the back. You're not a flabby part, I'm just using that.
I'm in nursing school.
So you just grab this area in the back. Again, disinfect the skin area. But when we gave an IM injection, we inserted the needle, injected at a 90-degree angle because we wanted to get to the belly of the muscle. This time we're going to go at a 45-degree angle because we only want the tip to be in that subcutaneous area. There will also be no need to aspirate with a subcutaneous injection. So I'm going to inject that area, and then I always pinch this up, inject, and that allows me to kind of rest the syringe on the side of my hand. Go ahead and then and inject the vaccine. And then right before I have finished injecting, I release that skin, and that almost serves to have a process like a Z-track of sorts. It kind of collapses the pathway, the track on itself. And then I go ahead and pull the needle out. I've got my 2x2 and my alcohol swab in my hand. I can activate the safety device, throw it away, and then apply the Band-Aid. All right. So those are the two main types of vaccine administration that we will use, either intramuscular or subcutaneous. There may be an opportunity to provide intradermal vaccine on occasion. That is becoming much more popular with the influenza vaccine, and we'll demonstrate that at another time. Very good. Thank you so much.